Wache, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. So in this episode, we're speaking with Susan Conway, practice consultant for the CD team who manages the STBBI portfolio. Welcome to our podcast, Susan.
Oh, hi, Anne. Thank you for having me.
Great. So today's focus is on syphilis. Why are we talking about syphilis?
So we're talking about syphilis because there's been an increase in cases of syphilis in Canada and Ontario over the last 5 years. Several First Nation communities in Ontario are experiencing outbreaks, and there has been 2 cases of congenital syphilis reported.
Oh, that's concerning, Susan. Could you maybe provide a little bit more background information regarding syphilis?
Sure. So many people may not be familiar with syphilis because you may not have seen it in clinical practice, but syphilis is a bacterial infection and it's usually spread by sexual contact. The disease often starts as a painless sore, typically on the genitals, the rectum, or the mouth. Syphilis spreads from person to person, skin or mucous membrane contact with these sores during oral, vaginal, and anal sex, but can also be spread by sharing needles and injection equipment, and can be spread from a mother to an infant during pregnancy and childbirth. Syphilis is easy to treat effectively if it's identified. The antibiotic regime is penicillin, but it's benzathine penicillin G, so long-acting, and if it's left untreated, it can have serious health consequences.
Oh, what sort of consequences?
So untreated syphilis, it progresses in stages. So there's 4 stages. So in the primary and secondary stage, a patient may experience symptoms. When you move into the latent stage, it's typically asymptomatic. In the tertiary stage, the disease can affect the skin, the musculoskeletal system, internal organs as well. Neurosyphilis can occur at any stage, which can lead to permanent vision and hearing loss. It can also result in meningitis, stroke, and other serious sequelae.
So earlier you mentioned 2 cases of congenital syphilis that's been reported in our region. Could you speak a bit more to syphilis in pregnancy?
Sure. So we are seeing an increase in cases of women of reproductive age. So syphilis in pregnancy is definitely a huge concern. So the risk of transmission of syphilis to the fetus during pregnancy, it's really dependent on several factors. Early detection is key, and screening should occur 3 times in pregnancy. So prenatal syphilis is left untreated. It can lead to things like miscarriages, preterm births, stillbirths, or severe disabling and life-threatening conditions for the infant. Exposed infants require regular testing throughout the first years of life, whether or not they've been diagnosed as having congenital syphilis. And they really should be followed by a pediatric infectious disease specialist. Even after treatment of syphilis in pregnancy, there remains a significantly higher risk of adverse pregnancy outcomes.
So when providing safer sex education and sexual health promotion, what are some factors the nurses should consider?
The important thing to think about when you're in clinical practice is really incorporating STBBI testing and education as part of routine client's care to promote optional sexual health. So offering testing as part of, routine visits. Testing should be offered to anyone that presents with risk factors, anybody that presents with symptoms. So for example, if someone presents with a genital lesion, you want to definitely offer testing. Anyone who has concerns about exposure or concerns where they're requesting things like emergency contraception or pregnancy testing. In addition to the symptoms that I mentioned before, you should try to keep syphilis in mind when you're seeing clients who present with rashes. Typically, but not exclusively, a generalized macular papular rash involving the palms and soles of feet may be seen in secondary syphilis, or if someone presents with lymphadenopathy. And of course, anyone should be offered testing who has or had unprotected sex or higher risk factors, such as things like they're not using safe sex practices, or they identify having unprotected sex, or if they have had multiple partners or anonymous sexual encounters. person who uses substances, somebody who has had another sexually transmitted infection, or someone who is currently working or has worked in the sex trade.
There seems to be a lot of important information to consider when we're thinking about syphilis, Susan. What sort of resources are available to the chins to help them out?
So we have a lot of resources available on One Health. So if you go to the public health unit and the communicable disease unit, there is a tab for sexually transmitted and bloodborne infections. And you'll see a syphilis page there where we have information including steps for syphilis case and contact investigation. There's also a syphilis toolkit, which has links to a lot of resources. CD team has also developed an education module on ITACID, specifically on syphilis. If you're interested in further learning, nurses can also download the Sexually Transmitted Guidelines app from the Public Health Agency of Canada onto their phone, which they can quickly access in clinical practice. And as always, the public health practice advisors with the CD team are available to assist with any questions or concerns.
So that was a great review, Susan. Thank you for joining us today.
Oh, thanks so much for having me.
Thank you all for listening to the Practice Support podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and ITACID, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.